Hi, my name is Robert Gregory Field. I'm a psychologist practicing in Westport, Connecticut, New York City. Now today will be part two in a two-part series in which I talk briefly about the concern potential patients can have about being judged either by themselves or others as they consider entering into therapeutic treatment. Now what is true is that psychological issues are real and have real impact upon the quality and direction of people's lives. Judging oneself or another as being quote-unquote crazy or as being self-indulgent in seeking treatment is simply to avoid and not recognize the truth of things. Like a fish, not being able to recognize the water in which they swim, people can lack the capacity or ability to recognize and understand their own or others' psychological dynamics. What they mostly recognize and react to are the problematic symptoms their underlying issues have led to and or created in their lives and experience. These show up in their emotional, relational, social, and professional lives and can be a source of a lot of the judgments. Therapy is ultimately about the process of making forward movement in one's life through these issues, i.e. growth, from states of being that have become stagnant and or problematic. Here, it might be interesting to think how this fits in with how we understand the dynamic of life itself and judgments around what might constitute health or ill health. So we think about the process of life as fundamentally entailing a kind of dynamic equilibrium in which balance is established and retained moving forward, maintaining equilibrium. Now one might think of the process of maintaining balance while riding a bicycle. And when balance is maintained, forward movement facilitated, this moves towards what we call being a process of health. And when this movement is impeded, life becomes stagnant, moves towards lifelessness. And here you can envision the lifeless stability of a bicycle lying on the ground. There's no life. And that moves towards what we call a process of ill health. Thus, being willing to examine oneself and to take steps to improve one's life is not only smart, it's a sign of health. And so if we're going to judge things, let's do so by that positive standard. So that's the end of this talk. Please tune in for other videos in which I discuss other aspects related to therapy or being in therapy. Please also note the link to my website below. It's got information about me, my practice, as well as contact information. Thank you.